So who's got a question you'd like answered?
Well, when I was giving, I was wondering about hand positions and wondering why do I have to have my two hands together? Can I just use one hand or have two hands in different places?
Okay. What happens is we're creating a field of energy. This is all about fields of life force energy. And as long as you have two hands, I recommend you use both of them. And if they're closer together, you create a stronger field. And the more you focus it, it's more like a magnifying glass on this particular area. If you're focusing into one little spot, it's like you heat up that little piece of paper and it burns. But if you try to heat up a great big bottle of water or a big barrel of water, you have your hands separated really far, you're not creating the field as intensely. So bring your hands close together. And if you've got two hands, I suggest use both of them. Who's got another question? Yes.
My question has to do with talking. As the giver, if I'm focusing 100% and putting my energy, having the energy come through me, does talking take away from that? Should I keep silent during the whole thing?
Okay, that's a good question. When you're running energy into another person, talking can take away from the session while you're working. Now, if you think about driving your car onto the freeway from being at a total stop, you push down on the gas pedal really far and you get the car up to speed, and once you get it up to 60 miles an hour or 70, then you can let up on the gas and it'll cruise at that speed. So if you're running energy, at first when you're bringing their vibration up to a higher frequency, you really want to focus, you really want to concentrate. Once you get it up there, you can say, well, how's that feeling? But I wouldn't really suggest having long conversations, but you can keep it up to speed without as much work. Keep it up at that higher vibration once you have it there. What other questions? Yes.
When you're using your hand, is it important to keep the hands still, and also to follow what the person is saying, or just follow what you feel?
Okay. When you're running energy, what you want to do is you don't want to move your hands around while you're giving the session. You want to have your hands still on one spot.
But it was mostly, when I say moving, it's not moving around like that, but it's moving like on the
Oh no,
spot.
keep your hands still while you're working, because it'll create a stronger energy field for the other person. Yes?
So as a recipient of the work, is it advantageous or deleterious or neutral for me to do the breathing as well?
It's actually a good idea, although I don't tell people about that at the very beginning, because I want people to see how extraordinarily powerful this work is, even without getting another person to do breathing. Now, during a session, you can improve the session by having the other person do some deep breathing, and what you really want to do is get them running energy. But if you tell them to run energy, they're going to go into self-doubt. So a very simple way of doing it is say, put all your attention underneath my hands, breathe deeply into that area, and tell me everything you're feeling. If the sensations move to another place, or if you're feeling more pain or whatever, let me know what changes. So put your hands on the spot, breathe deeply into it, tell me what's happening, bring your attention there. That's all you have to do, and that way you're getting them working. And a really interesting phenomena that happens is if you have your hands, say on somebody's knee, and you're running energy into that knee, and then after a few minutes you say, oh, by the way, put all your attention underneath my hands, breathe deeply into that area. Within a second, you'll probably feel this huge surge of energy in your hands. And you say, oh, good job. And they'll think, my God, she's psychic. She knew when I got my attention there. But you could really feel the difference. And so that's a very good way of working. Yes?
During a session, how long does it take the person that you're working on to begin to feel that energy?
Well, most people will generally tend to feel the energy right away. Within seconds, they'll often feel the life force energy. But there are some people who just don't feel any sensation at all, no matter how long you work on them. And I've had people complain, well, I didn't feel anything while you worked on me. And then they go, huh, weird, all the pain is gone. Because they just don't notice it. Some people's nervous systems are hypersensitive and they'll feel everything so profoundly. And other people are very more subdued and they're not going to feel a lot of sensation. And you have a question.
I'm wondering if it's ever painful to receive energy from a session.
Yes, it can be. Pain can flare up during a session and get stronger than it was before. And it's a very temporary thing, and then I encourage people to trust the process. let the pain do what it wants to do, let it go through the system. Remember this 13-year-old boy had had a skiing accident where he broke his knee, and after the cast was off, he was walking around with a limp, and his father said, "Hey, could you work on his knee?" So I said, "Sure." So I happened to be there, and I worked on his knee, and he said, "Ow, you're hurting me, you're hurting me." I said, "Well, breathe deeply," and he breathed, and he says, "Now it's on fire." And I said, "Well, just breathe deeply, it won't last long." And he breathes, and he says, "Ew, now it's weird, it's all pins and needles in there." And I said, "Well, just breathe deeply." He goes, "Oh, now it feels nice and warm and good in there." I said, "Okay, breathe deeply, that won't even last too long." And he breathes, and he goes, "Oh, that's fine." And he gets up and he walks without the limp. The next day his father said, "Work on him again." He said, "I don't need it. No more pain anymore." So you'll often see things flare up, especially from injuries. Injuries are the most common time for the pain to flare up, but it can do it other times too. And I always celebrate, by the way. Somebody says, "Oh, I'm getting all this pain when you're working." Well, you're just touching lightly, and now the person's experiencing a flare of pain. I say, "Good," because I know it's going to be very short-lived, and that's going to be the end of their pain in most cases.
Is it important that I keep track of my counting when I'm doing the breathing?
No, not really. What you want to do is just get a general sense of the timing of the breaths. I know some people are going 1, 2, 3. It's just too much. It's not about that. You get the sense of the pattern, and you just keep the pattern going. And you had a question up here? Okay.
How long should a session last?
Well, how long should a session last? There's no clear answer to that question. It really depends on what a person needs. I've seen a lot of people at my demonstration lectures where I'm doing 2 or 3 minutes on each person, and that's what they needed when they come to the workshop. They say, "Oh, this pain I've had for 20 years went away from 2 or 3 minutes." Other people may need a whole series of sessions. There was one man, a fellow named Lamar, worked on in Southern California, who had muscular dystrophy, and his calf muscle, Lamar said, was about 2 inches across. He was 60 years old, and he's never been able to walk. After a series of 1.5 to 2 hour long sessions 3 times a week that went on for 3 months, the man's calf muscle doubled in diameter, and now he's walking for the first time in his life. So there are too many variations to know how long a session should last. Basically, it's as long as the person needs it. Anything else? Any other questions? Yes, we got one over here. Yeah?
I was wondering, in quantum touch, how does it usually affect the emotions of the person you're working on?
This is a huge area that emotions can come up during a session. There can be tremendous emotional release during a session. If somebody's having a panic attack, you put your hands, it's where does it hurt technique. Where do you feel the panic? I feel it here, I feel it here. Wherever it is, you sandwich that part of the body, run the energy, and in almost all cases, people will come right out of the panic attack and feel better. We've had people with depth of emotional release from the sessions, and it clears it out from like a cellular level. It's very transforming. It's one of the most wonderful ways to work, and I believe in the future psychotherapists will all be required to learn to do appropriate touch and to use it when it's appropriate. Yes?
I was wondering, do you have to be in a loving space when you do this work?
Do you have to be in a loving space? Not really. What happens is, I've done this work when I've been depressed, sad, angry, hurt, just downright feeling rotten, and it works wonderfully well because the life force energy is what I think of as non-enculturated or non-associative love. It's a love we are as a spiritual being that comes through us. And if you're in a great mood, you can raise your vibration even better, but if you're not, it'll help your mood. Any other questions? Yes, we got one in the back.
I was just wondering, what are some of the biggest mistakes that beginners can make that would keep them from being effective?
This is very important because there's only 3 of them really that we see. One is being in an awkward position that's uncomfortable because that takes away from the energy flowing smoothly. The second one is having tight hands, which we talked about before, and having people, make sure that your hands are loose. And if you're watching this video, please help each other have soft hands. And if you see somebody in an awkward position, help them to move around and adjust. Don't bend over to work on the foot on the floor. Bring the foot up to your chair. Hold it in a comfortable position. And the third mistake is that people forget about breathing. You got to keep the breathing going. If you just do those three things, people will do wonderful work. And a question here.
So what if I'm working on someone and they don't believe in quantum touch? Does it still work? Or?
Yeah, that rabbit didn't believe in what I was doing either. I didn't say to the rabbit, "You're getting very sleepy." The chiropractor didn't believe that the bones were going to move. We're having people who are under general anesthesia who are receiving quantum touch sessions, and the blood oxygen level, when it dips down to 92% and it starts being critical, and the patient could die or get complications or infection, we got a head of the anesthesiology department doing sessions and bringing the blood oxygen level. And placebos don't work when people are under general anesthesia. So it doesn't matter how much or little a person believes in the work. We're working with a real force of nature, the life force energy, and it does what it needs to do on its own. I'd like to talk about the resonant principles that increase the power of your quantum touch sessions. There are some mandatory ones. The first one is running the energy. That's doing the full body sweeps. It's absolutely essential that you keep that going throughout the session. The next one, of course, is the breathing. You've got to keep the breathing going too, and then linking the two of them together, where you have the breathing, the body sweeping, and you're linking them together. So on the inhalation, whenever possible, except for the fire breath, you're feeling that full sweep going through your whole body, and then having it rush into your hands and moving through. You connect the breath with the energy. The next principle of resonance is intention. Now, intention's a funny thing, because all of you have intention to do hands-on healing work, or you wouldn't even be here today. You've probably had intention of helping people in one way or another through most of your life. It's not something you have to develop. If you have an intention of walking out the door in the back of the room, you don't stop yourself on the way and say, well, am I still intending well enough to go out the door? Perhaps I should take a workshop on how to intend better. No, it's just something you do. It's basic, it's intrinsic. You have the intention to do the work, and let go. Don't worry about it. It's your intention, and you're just going to do a wonderful job with it. The next one is love and gratitude. You know, you can increase the effectiveness and the power of your sessions through intentionally allowing yourself to open up to love and gratitude. If you're not in a place to feel love or gratitude, doing the work will probably raise your emotional mood and bring you closer to a place where you can feel it. There's a woman who, when she wanted to feel love and gratitude, what she did was she thought about one of her cats. She has this one cat that she totally adores, and whenever she loves all 10 of her cats, but this one cat just causes her heart to bubble over in love, as she would say, just overflow with love. So whenever she does a healing session, she would pay attention and remember how much she loves that cat and run the energy. This is what I call the what you love most technique. You bring all your attention to something that you love the most, something that makes you feel inspired or joyful, and you bring that emotional vibration through your body and then out your hands, and it's a wonderful way to do it. Another one is holding a positive expectation. Now, what do I mean by this? When you are expecting someone to get well, that's a positive expectation. Now, Bob Rasmussen took this to an extreme, and he would look at each person he was working on and figure that, well, the body has its own perfection, and I'm going to put energy in here. The body's going to do everything it can. It's going to move right into that perfection. He would expect everybody to get totally well. In fact, one of the things that he would do is he would look at the person, see them as totally well, and run the energy in with the assumption it's already done. That's pretty radical. And if you can do that, that's wonderful. But a little milder form of just moving in the right direction, which is all that's really necessary, is to think, well, this has worked with all kinds of conditions in the past. There's every reason to believe it might help here. That's called positive expectation. You don't have to lie to yourself to hold positive expectation or even exaggerate what you believe is possible. Say, hey, who knows what's possible here? Let's just find out. That's positive expectation, being open to possibility. There's one of our teachers of Quantum Touch who has coined his own little phrase, and his favorite phrase is, we know no limits with this work. I know no limits. And whenever he's encountering a condition that he has, from my perspective, no reason to believe it's going to help because he's never seen anything happen with this kind of condition, he just thinks to himself, I don't know the limits of this work. I know no limits. And then one time he was telling me about a congenital hip problem that just completely shifted under his hands, and all kinds of things have occurred because he knows no limits to the possibility. So holding your own positive expectation as clearly as you can is a wonderful way of working. Another one is asking for help. For those into prayer, go ahead and use your prayer. If you have friends in high places, call on them. Asking for help in any way that you can, or you've been trained to do it, is a wonderful way to work. It also raises your resonance and allows that help to be present. Another one is giving it your all. A lot of you are already doing this when you're doing a session. What does it mean to give your all? It means pedal to the metal. It means you're not doing anything but quantum touch. You're completely giving yourself to let it happen. Now there's some people who are doing extraordinary work, and later when I talk about the supercharging class, and Alan, who teaches that class, I've asked him about some particular practitioners who are doing such good work, and he said, you know, both of those people you mentioned, he said, are doing incredible work, and their energy looks like anybody else's energy. He said, but the secret of why they're so good is that they don't hold back. They're just completely giving their all to the process. Their joy is flowing. They're just completely diving into what they're doing. And that's a way that it works really effectively. So give your all. And then get out of the way. Let it happen. This work is a really elegant balance between yin and yang, masculine, feminine energy. Here you are. You're breathing and you're focusing and you're holding and you're doing. It's a very doing process. But in the process of doing, your hands are relaxed and you're getting out of the way and you're letting it all happen. It's a feminine energy of allowing, and the masculine energy of doing. You can almost think of it like doing, allowing. And so you've got this nice flow of masculine and feminine energy, and you're getting out of the way to let it happen. Another very important one is letting go of the attachment to outcome. Oh boy, is this a big one. A lot of people want to believe, I am the healer. Well, we talked about that earlier. The definition of the healer is the person who was sick and got well. You can't heal anybody else. Anybody who thinks they're healing other people is either mistaken, arrogant, egotistical, or delusional, because their cells have to heal themselves. You can't do anything to make that happen. So it's not your job that they get well. Your job is to hold a high resonant field of vibration. Their job is to entrain to that vibration. Their job is to match it, to let their body heal itself. I have seen so many sessions where you're working on somebody, and at the end of the session, I say, how's it feeling? They say, well, it's about the same. And then the next day, or that night, they've had a tremendous transformation because maybe the body doesn't heal according to your clock, according to your expectations. The body heals at its own pace. There may be transformational things taking place, but just because you can't see them doesn't mean they're not there. So when a wonderful session happens and you see fantastic results, you don't say, oh, what a good healer am I. And when you can't see the outcome, the results of what you've just done, you don't say, oh, I'm terrible, I'm no good at this. Neither one is true. What you can say is, wow, I'm holding a really high resonant field. And one day we'll be known, of course, as resonant physicians, because that's what we do, is we hold resonance. Their body heals itself. So let go of the outcome. It's not your job or responsibility that they get well. It's not for you to see the result right now necessarily. There have been countless times where we don't know what's happening. I remember in one incident that's really worth bringing to mind, there was a woman who brought one of her patients to one of my lectures. She was a physician herself, and her patient was in her late 80s. An HMO had irradiated her intestines and she could no longer eat food. Her liver enzyme levels were 540% above normal, which means that she's so toxic that she's dying. And the liver, being the organ of detoxification, means that no matter how many new generations of cells the liver produces, they're all toxic cells because the liver couldn't detoxify itself. And two of us gave her a session that lasted for 20 minutes. At the end of the 20 minutes, the doctor said, well, I think she looks a little brighter, and I think her voice is a little less creaky. Yeah, I suppose, said I, but I couldn't really tell that anything wonderful or fantastic had happened. About 7 weeks later, I got a call from her physician, and her physician said that in the course of that 7 weeks, every week her liver enzyme levels dropped further and further and further. After the first session, her liver enzyme levels dropped over 100 points. And every week they continued to drop, and she said now they're at the high end of normal. And the reason I didn't schedule for any more appointments, said the doctor, was because I wanted to see what would happen just from a single session. You cannot evaluate effectively the results of your work. You need time and you need perspective to be able to see what happens. And the last one of these is to trust the process. I've talked about this a couple times already. Trust that the body heals itself. Trust that the cells know how to heal themselves. I remember one time I was driving along and I heard a doctor say, well, it's very hard to come up with a vaccination against cancer because how do you attack the part of the body that's attacking itself? And I had this Gestalt awareness at that moment. And I go, oh my God, this guy really thinks the body is stupid. Because you don't have to attack anything. If you create a high enough field, the body will do what it needs to do. We've seen so many cases where people with cancers the body knows how to heal itself. It knows which are the bad cells. It has the lymphocytes and the other killer cells and the things that can attack the cancer. It's been well known for years. Trust the process. You may see things happen during a session that may look kind of scary. Somebody may cry or shake or something may happen. We have always seen that problems are ameliorated. Is that the word? Yeah, I guess I said it right. That the problems are always resolved and helped with more energy. If somebody says, oh, I can't take any more energy or it's too much pain coming up, encourage them to receive more. The problems are always resolved with more energy. Trust the process. It works out wonderfully well. Now, there are certain patterns of energy that people feel in their hands. And let's cover them at this point. When you're running energy, you're creating a field. You're not really running the energy into a person, although I may say that from time to time because it feels that way to the person. But what you're really doing is creating a field that they're in training to. And as that interaction takes place between you and the other person, there will be different sensations in your hands based on that entrainment process. So, as you're running the energy, you may feel what I call the common pattern. And the common pattern is you feel some vibration in your hands, and the sensations tend to get stronger and stronger and stronger. And then eventually, at some point, they may level out, and then they just kind of dissipate and go down. That's the traditional pattern of it getting stronger and stronger, leveling out, dissipating, and going down. When it starts going down, that means the tissue there has received pretty much all the energy it can at this time, or it's entrained pretty much as far as it can at this time. The next pattern is what I call the blocked pattern. And the blocked pattern is one where you're running the energy and it feels like almost nothing is happening at the beginning of a session. It's almost like it's dead tissue. And if I run the energy and I feel almost nothing, I can say to the person, oh, have you had this for a very long time, or this is pretty severe? Even though I know nothing about the condition, they'll say, oh yeah, I've had this for a very long time, or it's been really stuck for ages. It's blocked in that area. So you may be holding a high vibration, they're at a much lower vibration, and their body is very slowly entraining to your vibration. So there's a very slow pattern of the intensity in your hands going up higher and higher and higher before eventually it levels off and may go down. I remember one time I was working on a man who had severe cardiomyopathy. To put my hand on his heart was spooky because it felt like his heart was the size of a football. And as I was running the energy in, I could feel his heart just beating huge beats, and then I could feel gurgling between beats from time to time. In the course of an hour, his heartbeat got softer and softer and softer. He told me that before I started, it felt like somebody was pounding him in the chest with every heartbeat. And when I was done, he said he couldn't even feel his heart beating in his chest. Through a series of sessions, and by the way, the reason I'm telling you this is because it was such a blocked pattern at the beginning. It took a long time before the energy came up. And then I was going to finish the story, actually partially finish it, maybe I'll finish it all later. But through a series of sessions, his heart actually shrank back to its normal size from a series of sessions. That's according to his physician, that his heart shrank back. So that's the blocked pattern of energy. Then there's the intense pattern, where you touch a person and you feel this intense amount of energy in your hands right from the very beginning. The body's just drinking it up, it's accepting it. It tends to go up a little higher, level off, and go down. So all three patterns are essentially the same. It's just a matter of the speed. The block pattern's very slow, the normal pattern's faster, and the intense pattern's very fast. But there's two other patterns of energy to pay attention to. One pattern is called the step pattern. It's like going up a series of steps. And the way this works is you're running energy, and you level off at some point, and you think, boy, that's as much energy as this person is going to receive. And then you think, I wonder what would happen if I do a fire breath. So, remember, it's inhale and exhale, not just exhale. So you do the fire breath, and all of a sudden, the energy level jumps to a higher point, and it seems to level off there. And you try another fire breath a couple minutes later, and it jumps again. And it keeps jumping and jumping and jumping until it finally tends to just stabilize and level off, and it may go into the last pattern. And the last pattern is what I call the disappearing pattern, or the invisible pattern, where you've run the energy, and then all of a sudden at some point you think, I must not be doing a good job because I don't feel anything in my hands. You know how many people at some point will say that phrase to themselves, I must not be doing this because I can't feel anything. Then you take your hands off the person and you feel this huge amount. Now, when I was at Norm Shealy's office and we were working on his most difficult chronic pain patients, during one of the sessions, Norm said, Richard, he said, I'm not feeling anything in my hands. I said, take your hands away and tell me what you feel. He took his hands off and he said, well, my hands are buzzing and tingling like crazy. I said, right, now put your hands back on. He said, I don't feel anything. I said, that's right, because your hands, her body rather, has completely entrained to the vibration of your hands, so you don't feel anything being there, because there's pretty much at the same vibration. And then Norm said something that was so inspiring to me. I think I may be inspired for the rest of my life. He said, I would like to see, he said, that means you can't give too much energy to the person you're working on. He said, I would like to see group quantum touch sessions given to everybody, every critical care patient, 24 hours a day, round the clock. Oh my God. When that finally happens, that's going to look like Star Trek science fiction. Because one person can bring down inflammation and reduce pain radically. You get a group of people, they're going to do marvelous work. You get a group working 24 hours a day, round the clock, at every hospital, it's going to be things we've never dreamed of or imagined before. So, those are the patterns of energy that you can work with your hands. There's some other ways of running the energy that I want to talk to you about. Right now, we're going to cover what's called vortexing the life force energy. It was really wonderful. The woman who came up with what we call the supercharging technique was a woman I'd met as an administrator in an office building in Ashland, Oregon. And as I was working on her knee pain, she was telling me all this detail about what I was doing energetically, and I didn't know if she was being accurate or not. So I tested her, and the way I tested her was I started vortexing the energy. And within about a half a second, she said to me, "Oh my God, I've never seen energy spin like this before." And I immediately knew I had somebody who could clearly see the life force energy. Well, vortexing is a way that we move the life force energy. Now I realize that things that spin travel in a different way than things that just go straight. Electricity going down telephone lines doesn't just go down the line, it spins through the line. Water, as it's going down a hill, meanders as it travels. Bullets from guns penetrate much better as they're spinning. They get cannon fire and all kinds of things turn. Frisbees, you don't just throw the frisbee like this, you gotta spin it, and it sweeps through much more effectively. Well, the energy is the same way too. That when you vortex the energy, you can cause tremendous amount of increase in its power. Now, this is a technique that most people really enjoy, and I'm going to give a whole series of techniques in the hope that you find the ones that you really like working with. So, here's how you vortex the energy. As you sit here, try feeling the energy going up your legs, spiraling up the legs. Now it can go the same direction up each leg or different directions, any way it wants to go. It doesn't really matter which way the energy spins. What matters is that you feel it. Bring all your attention and awareness into your body. Feel it spinning. And have it spinning up the legs, through the torso, up to the top of the head, down the shoulders, and down the arms. Another important point, as you're practicing this, is realize when you are doing quantum touch, what you want to do is you want to feel the spinning or feel the sweeping always go to the top of the head. Don't cut it short at the shoulders because you're missing a couple extra chakras. So feel the energy spinning all the way up to the top of your head, then down and through the arms and the hands. Feel the spinning going through the middle of your body too, not just on the outside, but feel it going all the way through you. And the more sensation you can feel when you're doing this, the more effective it is. So let yourself do that now. Do some breathing too, and you might want to cup your hands and feel the energy gathering in your hands as you're vortexing the energy. Do the breathing. Feel at least one of the breathing techniques. Feel the breath and feel the vortexing. And now let's try a variation of it. Try spinning the energy so it's not just going through your body, but it's going around your body too, creating a wider circle, kind of like the Michelin Man, this big sweep going around your body. So feel that. So it's going through your body and around your body as well. And feel the energy in your hands, the amount of sensation you're feeling now. Let it get stronger and stronger. And here's another variation. If you were running the energy and you were thinking of a sound of the energy spinning through you, and the sound was whoosh, 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 you know how fast that is. What if the energy was going whoosh, 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 get it spinning faster and feel the difference through your body. And you can just think of a sound like that, like it's going really fast, just going round and round really fast. So feel that energy spinning. How's that feel? Stronger? How's that feel? Stronger? Yes, good. Good, glad to hear it. And so when you're running energy, giving a session, you can vortex it, and you'll get a deeper penetration of the energy. Another thing you can do is use your intent to have the energy penetrate, to connect the two hands together. So the energy actually goes between the hands and connects. It's more strong that way, that you actually have it linking together. It's a very wonderful and powerful way of working. Okay, so you get a sense of the vortexing now. There are a lot of hand positions that I want to show you. I kind of streamlined a lot of hand positions before so you could get your first practice session in before lunch, but let's go into more detail. If I can borrow you again. Okay, so have you stand here for a moment. Now the first one is the occipital ridge, and if I clear your hair to the side a little bit, you can see that on the sides of the head there are these little grooves. You can feel it on yourself. As you press the back of your head, there's these grooves on the side. You feel neck, 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 like neck, 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 and then all of a sudden you hit bone. Feel it on yourself, and then you can try to lift yourself up with these handles. I just can't seem to lift myself very high doing it this way. But you can touch these spots and just pull the hair out of the way so we can see more clearly. Yeah, boy, you got a lot of hair. And just let your head be upright. As I touch it, I can see that they look pretty level on you. And some people, they'll look like this when you start. And then in time, just within a few seconds, usually they'll roll and become level again as you run the energy in. The joke is, it's easier to get the occipital ridge to move than it is to measure it. And for most people who are unaccustomed to measuring the occipital ridge, they're fiddling around. It's very uncomfortable for the person, having the person kind of tapping over and over again. But when you finally find where they are, and if they're uneven, you start running the energy, and on your first breath, they'll usually just straighten up right away. There have been many cases, and I was one of them, where the occipital ridge, as it moves, the orbitals in the head will move too. And when it was done to me the first time, I was sitting on a massage table. Bob Rasmussen was working on my head. I'm staring out an open window, and all of a sudden, the windowsill tipped sideways like this. My head hadn't moved. But the orbitals, which were uneven in my head, the occipital ridge was high on the left, and as it leveled out, the orbitals in my eye sockets moved. The windowsill tipped sideways till I blinked, shook my head a little bit, and then it just straightened out again. That's just happened at least to 15 or 25 people over the years, that I tell people, leave your eyes open when I do this. If I see somebody with a very uneven occipital ridge, this moves so quickly, so easily, that for many of you who have been running energy, just the process of measuring it will have moved it already, even before you had a chance to do the job. So if you just very lightly touch and carefully touch and feel where it is without trying not to run energy, you can actually see that it's uneven. And then as you touch it, it'll roll back to place. Now I had one man come up to me. Sorry to have you standing up here while you can just hang out here for a minute. One man came up and he said, I didn't want to humiliate you in front of your entire audience, but I know you can't possibly move the occipital ridge because it's fused together. He said, I happen to have a PhD in physiology. I said, oh, I'm so glad to meet you. Come here. And so I found somebody whose occipital ridge was massively uneven. I said, what do you see? He says, high on the right. I said, how high? And he measures and he says, well, it's at least a half an inch and it might be 5/8. I said, that's exactly what I see. So I touched it for about 2 to 3 seconds and I measured again. I said, okay, now why don't you check it? He's looking like, why should I bother? I just measured a moment ago. And he measures and he remeasures and he's looking. He says, well, it looks completely even. I said, do you have any interest in researching it? And he said, no, I work on amphibians. And with that, he just turned around and walked away. Like that was the end of our conversation. And as he left, you'd see this tail doing this on the way out. But what's so amazing is here's another professional physiologist saying this cannot possibly happen. This is another phenomena that's outside their belief system. But you just touch that occipital ridge and it moves back. And it's easier to be happy when your brain is on straight, when your head is on straight, when you got it all lined up inside. And the body intelligence knows how to move those things. Can you imagine what's going on to get that to shift? We don't even have words for all the stuff that's going on. And it just happens within about 2 to 3 seconds in most cases. All right, let's go back to this again. For neck pain, the atlas is just on the sides about here and here. Then you come down a little further, the axis vertebrae, known as the first cervical and the second cervical. Then you come down on the sides of the neck, third, fourth, fifth, sixth. The seventh cervical is the one that sticks out really far, the bump in the back of the neck. This one often requires a lot of energy to run the energy through. You can work inch by inch down the spine, any point on the spine. While they're standing, the hips move very fluidly. So I like to work on lower back pain while a person is standing in place. For sciatica pain, oftentimes people will have right around here on both sides, it's called the piriformis muscle. And if you put your fingers on one side with the piriformis, let me turn you around a little bit, and then on the other side with your hand, let me stand over here so the camera can see it better from the front. This is about where the psoas muscle is. So just turn you around a little bit. So I got one hand here and one hand there, and I'm running energy through the body, through the psoas and the piriformis. So if they have sciatica on this side, I'd run the energy here primarily. It would be good to balance the hips out, get them even, work on the neck, and work on those sciatic points. If there's pain in the upper back, chiropractors know this, and they have all these charts showing a line from here down to here and a line from there down to here. They reflex each other. If there's problem in the upper back, you also need to work the lower back. If there's problem in the lower back, you need to work the upper back. And you know what? If you didn't know this, you'd figure it out. Because you're working on their lower back pain, and they're saying, oh, it feels really good down there, but now I'm hurting up here. Well, it's not because you did a bad job, it's because you did a wonderful job, and their body is saying, oh, I'm so balanced here, but now I notice the imbalance that's up here. You didn't notice that imbalance. Ah, you had that happen today. Great. Yeah, that's exactly what happens. You get the imbalance here corrected, and then the imbalance over there starts showing up. This is the elegance of the system. You need to know nothing. You could have, we've had children as young as 8 years old taking the workshops, and all they need to know is chase the pain and sensation. And that's all the education you need to run the energy effectively. So you work on the spots in the upper neck, upper back, and the lower back calls for it. You work on the lower back, the upper back calls for it. Or just be smart and work both. If there's pain in the mid back, you need to work upper back, lower back, and then into the middle areas, because you balance them both out. It's always good when you're giving a session to spend some time, just for a moment with the occipital ridge, a little bit of time on the seventh cervical, a little bit of time balancing the hips in the back, balancing the hips in the front, touching the sacral area here with the thumbs, running the energy in, and maybe doing a little bit of hip balancing from the front. Let's see what you got. Ooh, look at this. We got a nice uneven front of the hip. Now, would somebody like to balance this one out? Would you like to? Yeah, why don't you come up here and touch it right there and there. And do we have a good camera angle on this? No? Okay. Did you see the picture before I started? Good. Okay, run the energy in. Big breathing. It's always amazing to me to watch this happen, and it just happens so regularly as to astonish me. Do you feel that as she's working? What do you feel?
It's very hot.
Very hot. Do you feel any sensations going through your body?
The heat is running through, minor tingling.
Minor tingling and heat running through. Okay. Well, let me measure again. Look at that, folks. That's something? So, you got a shot of this? Okay, why don't you come over here? Okay. Take a look at the hips now. Balanced out. Okay, so let's see. We got the upper and lower back, the mid back. A good way to begin, balancing the occipital ridge, the hips, balancing the lower back. This is a pretty good thing to do with pretty much everybody before a session. It's just balance the occipital ridge, the hips, the 7th cervical. Just kind of get sort of like opening the hood of a car. It's general tune-up. Then, if you wanted to work, say, on carpal tunnel, what you'll notice is that if the person's having sensations going down the arms or the forearms or the wrist, I like to know if they've had an accident that would be causing it, or, you know, did they get banged in the forearm if they're having forearm pain. But a lot of times it's due to problems with the 7th cervical and 1st thoracic. So 7th cervical and 1st thoracic are right here and here. This will pinch nerves causing sensations to go down the arm. So I'm always suspicious. Maybe they banged their arm into a wall and that's why it hurts so much, or into a table or something, and then it would work specifically here. But if a person has pain going down through here or weak wrist, I suspect 7th cervical and 1st thoracic as a definite part of it. There may be shoulder problems, there may be elbow problems. If you're working the wrist for carpal tunnel, one trick is you don't want to turn the wrist like this because that will hurt them over time, and you don't want the wrist upright, although it looks really nice either way. These put strain on the wrist. Most of you sitting have your wrists in a neutral position like this, where your thumbs are aiming somewhat toward the ceiling, like you're sitting there. If you work on the wrist, that's the best place to go, and you can run energy right through the wrist like this. And this is a great way to move the life force energy through the joint. If they've got carpal tunnel, you definitely want to work the wrist. You may want to work the elbow. You may need to work the shoulder. You probably should work the 7th cervical, 1st thoracic, and you may need to also work on the lower back. Probably need to do a little bit there. A lot of people think carpal tunnel is just this, and they put a band around the wrist. It's so much more than that, because say somebody has a bad foot injury and they're walking weird. That puts strain on their hips, which then puts tremendous strain on the 7th cervical, 1st thoracic, which then impinges on nerves here. And then they got this weak wrist, and when they're typing, their wrist goes out, and they say, oh, well, you put a band on your wrist. It's the simplicity that's so crazy. So we can work on all these different areas. I've actually worked with carpal tunnel with knee and foot problems to get the carpal tunnel well, and it's helped a whole lot. Another one, I mentioned sinuses before. So this would be a good sinus position, sort of like Mr. Spock. Fascinating. Except you want to use both hands. This is not a mind meld, unless you can do it, and then that's great. If they had a gum infection, you could work right through here, or a sore tooth or something. You could work right in through the gums. You could also work the sutures of the head. And there's a picture in my book, I believe, working on emotional things. I talk about working the sutures. You can feel on the sides of your own head, there's kind of a crease line, so kind of above the glasses line. On the sides, you kind of feel a little crease. And if you press in, it's pretty sore in there. That's one of the sutures. And maybe we'll do a special shot and show the picture of the sutures from my book, page 177, and put it in there. So you can run energy into the sutures and balance out the cranial bones and get them to come into alignment. Let's see, I also talked before about running energy through the major organs. So if there was like a liver problem, you feel where the rib cage is and come right into this area, front and back. You want to run energy generally right through the organs. Have the energy pass right through the body. The only exception is like kidneys and adrenals, where you can be right on top and run the energy into the person that way. It's enough of a field to really get through there very effectively. Okay, thank you very much for being such a gracious model. So there's one more thing I want to show you at this point, which is what I call the slope breath. The slope breath is a breathing technique that many practitioners discovered because after running the energy long enough, they discovered that they were doing it. You know, as you do, with this work, it's not just theoretical. You feel that you're moving the life force energy. You feel what you're doing. It's not like, well, I'm imagining that I'm running energy. No, you feel the breathing, you feel the life force energy, you feel the sensations in your hands, and it's all about seeing what you can do to increase the sensations of the life force energy as you're running it. Now, the slope breath came about quite naturally for many of us because as we were doing the breathing techniques, we were naturally falling into doing this particular breath. It's a little bit more challenging than the regular breathing, only in that it requires a deeper level of awareness of the life force energy, but I think you're ready for it now. What you do is you start with a big inhalation, as you normally would, but at the top of your breath, you hold it for like a fraction of a second, maybe half a second, and while you're holding it, you have all your attention in your hands, and then you start letting the breath out very slowly at the beginning, and you feel the sensation increasing in your hands. And then as you're letting the breath out faster, like going down a slope of a hill, you feel the sensations growing as the speed of your breath is picking up. And by the time you reach the breath is coming out very fast at the end, you feel the energy just shooting out like a flamethrower. It's getting stronger and stronger and stronger. So it's like, I'm making that louder than it needs to be, but just for the purpose of showing you that you start up, let it out a little bit, and feel the sensations. You are linking the sensation of your hands to the exhalation. And as the breath comes out faster and faster, the sensations in your hands get stronger and stronger. And that is a way to increase the power of sensation. By the way, we'll start setting you free at this point. Any visualization or breathing technique that you can conceive of that increases the sensation in your hands will be valuable. You can start making up your own techniques. You can do it your own way. And you don't have to follow the rules. You can start doing it, but the only rules that I would really stress is keep the breathing going and do full body sweeping. But beyond that, as you focus in on your hands and the sensations through your body, whatever visualization or imaginary thing you can conceive of that increases sensation will increase the power and effectiveness of your work. Anything that brings you more gratitude or joy will increase the power of what you're doing. So that's the slope breath. Is that clear? Good. Next, one thing that I really want to stress again that we've talked about a little bit is be comfortable while you're doing the work. I see people in almost every workshop finding some incredibly awkward positions to be in. If a person's standing up and you notice your arms are getting tired, I've had people say, well, this work hurts my shoulders. And I said, well, you're not supposed to work with your arms up like this working on this person. They're supposed to sit down. You go, oh, that's much better. You can get them to change. You can get them to move, get them sitting. You stand up, standing closer, bend your elbows. If somebody's got a foot problem, have them put their foot up on your lap. Work on it that way. Speaking of which, we've actually seen many people whose bunions have, from time to time, actually reshaped themselves somewhat or even largely in class. You know what doctors do to bunions? They take a saw. And, well, and the person's limping around for 6 months. It is so exciting to see something like that where, you know, a 20-30% shift or more can happen during a session of the bunion. The person's walking differently, and then over time have it reshaping itself. So you don't need tables or incense or special candles or music or your special healing room to be able to do this work. you can do it anywhere that you are. I like to call them, I've called them cafe sessions. And I've done them just about anywhere I am. I remember one time I was in a bank, and I ran into a friend I hadn't seen in 20 years. And she's now an acupuncturist, and she heard about my quantum touch work, and she said, "Oh, I'd love to experience the time." I said, "Well, come out to my office." And she says, "Where is that?" And I said, "Well, it's in the parking lot." Because I figure my office is wherever I am. So she's out in the parking lot, and I have her take her back brace off, and I run energy in the parking lot for about 7-8 minutes into her lower back, and she thought I was heroic, because here's this tremendous amount of back pain that causes her to need a back brace. I run energy for, I don't know, 6-8 minutes, and her back has completely rearranged itself, and now she doesn't need the back brace. To her, I'm heroic. To me, I'm having fun hanging out with an old friend for 6 or 8 minutes. It is so little to give a person the time, whether you're in a bookstore or a cafe or, like I say, a train station or wherever you happen to be. This is something you can do without a massage table, without your incense and candles and healing music and everything else. Although those things are all wonderful, should you have the opportunity to use them, you don't need to. As long as you have a chair or a floor or both. And by the way, I've never been at a place that didn't have a floor. So you can use the floor, and they can stand on it, and you can do amazing work with the lower back while they're standing, because when they're standing, the hips will roll and turn quite easily and smoothly. When you have a person who is sitting, it's more comfortable usually to work on their shoulders and their head and their neck and such like that. Or if they're sitting, they can put their foot up, or you can work on their knee while they're sitting. Sometimes I have people put their leg across mine and just hold the knee. You can find comfortable positions, but by all means, do find a way to be very comfortable. Now, in the next session that you're going to give each other, I want you to practice the slope breath. I want you to definitely continue doing the fire breath and the 1-4 and some other breaths, but find out what works for you. And I also want you to start doing group sessions. Now, there's a way to do group sessions that you may not have thought of. And by the way, as far as I'm concerned, 2 or more people working on one person as a group. And so I'm going to borrow the 2 of you if I can. So why don't you both come up here and have you stand here. Now say we're working on her shoulder. I'll put one hand on her shoulder here, and you put one hand on top of mine, and then you put one hand here, and I put one hand on top of yours. This is called patty caking. I know it's a high-tech name here, but you see what's happening? She has one hand touching directly, and I have one hand touching directly. And we can both run the energy into this one spot. Thank you. Now, the reason that this is so effective is I have one field of vibration, and the other person has one field of vibration. As I'm running energy normally, when 2 dissimilar vibrations are in proximity to one another, there's a resonant pattern between the 2 vibrations. There's a resonance that occurs, and resonance is more powerful than either of the individual vibrations by themselves. Now, when she has one hand touching here, and I have a hand on top, and I got one hand here, and she has a hand on top, there's one vibration of her hand touching with mine on top there. There's a slightly different vibration of my hand touching with hers on top, which creates a more powerful synergy than either one alone. So we're creating a synergistic effect. It's more like 3 times 3 as opposed to 2 plus 2. It's a massively larger impact. So when you're working with 2 people on one, what you can do is sometimes when it's appropriate, when it works out that way, you can have the people linking up their hands where 2 are in one spot. And if you've got a group of people working, more than 2 people, you don't always have to patty cake every single spot. You could have one person working here and one person working there, and then have a patty cake down here and maybe another one up here. You could have 4 or 5 people working on one person if you wanted to. In fact, I got a call from somebody in Southern California who wanted me to meet with a group of physicians who were astounded because there was a woman who had already gone through full chemotherapy and radiation, and they gave up on her and said, well, sorry, but you're dying. We can't help you at all. And a bunch of people who had taken the Quantum Touch workshop had heard about her, or they were friends with her, and they weren't going to let her go that easy. So they gave her group sessions every day, every single day. And the doctors were astounded because she made a full recovery after they completely gave up on her, which was so unheard of. Because by that time, after they've burned and radiated and, you know, poisoned the body, to have a complete recovery is pretty darn astounding. But that's the power of group sessions. So you work on each other, and don't try to be perfect about it. If you can do a comfortable patty cake with each other, great. If you've got more people doing it, fine. But don't try to stack 3 hands in one spot. There's not a great deal of improvement getting a third set of hands. You can once in a while, but I would generally try to go to another area. So if you've got 2 people working on one spot, you know, this person and that person patty cake in their hands, let the next person go to the next spot that needs it in the next spot. So if you've got a group, let them work around the body wherever it is and to fully work with it. So you can vortex the energy as you're working with the patty caking and use the slow breath. And these would be wonderful things to be working with. And so I'd like to also review the breathing a little bit, because I know that some people just don't always get it fully the first time around. So there's a 4-4 breath. And a secret to the 4-4 breath. It sounds so easy, and it is so easy, but this breath was actually one of the last breaths we came up with, and it's one of the most powerful breathing techniques. And a friend of mine, who's also a Quantum Touch instructor, Henry Ferguel, who used to live in Boston, and I was in California, we both came up with the same idea on the same day. And I called her up one evening, and I said, hey, I came up with a new breathing technique, and she said, so did I. She said, what pattern of breath? I said, well, it's a 4-4. She said, so did I. And we described it to each other, and we had the exact same idea. She said, what time did you come up with yours? I said, 3 o'clock. I said, what about you? She said, 6 o'clock. East and West Coast. We came up with the same idea at the exact same time. And the secret of this breath that makes it so powerful is that on the inhalation, what you're doing, because you're taking so long to inhale, we're using more time to do an extremely conscious full body sweep. So you just don't go and just do it casually. It's not a casual full body sweep, meaning that you're feeling the sensations moving up your body. You're doing a very intense, conscientious full body sweep to the count of 4. That's what makes it so powerful. It's as if you're gathering energy all the way up, doing the full body sweep. And then when you get to the top, then let it just surge into the hands. So let's try that again, maybe with a different perspective now. Feel the sweep. See how much awareness you can bring through your body. And move a lot of air. Don't get wimpy about your breathing. You don't have to make a lot of noise, but I want you to move a lot of air. You will have totally different results if you have full breathing when you're doing this. That's better. Gather the energy in your hands and feel the difference you can make by having a highly conscientious full body sweep. Conscientious. That sounds better. All right, good. Does that feel different? Yes, I see a lot of heads nodding here. So the 1-4 breath, of course, is a big inhalation, the count of 1. Inhalation through the mouth really works well, and you want to move a lot of air. The fire breath, let's do it together. Remember, it's like panting. And then don't do it again for another minute or two. Yeah, that's good. A few people may do this breath incorrectly, and let me give you a heads up. If you see anybody in the room doing it wrong, please help them. It's like panting. Some people may hear it and think it sounds like that's called 1 inhalation and 6 or 7 exhalations. It does nothing. It's really holding your breath. This is okay, so that really gives you a better idea of it. So it's like panting where you're out of breath and you're catching your breath, so you're really moving the air. That raises the life force energy very, very well. Then there's the 2-6 breath. Inhalation for 2 and out for 6. It's pretty simple, pretty easy. And then the slow breath that I showed you. Finally, be aware that emotions can come up during a session. We've had people who just find themselves tearing, and it's so beautiful to just kind of feel whatever it was, and you don't even have to know what it was. The emotions from the past often get locked into the tissue of the body. Dr. Candace Pert did the primary research, and she found out that the brain receptors actually exist all through the entire body. They're not just in your head. Your head isn't just in your head. We're not just a mind and a body, we're a body-mind, or a mind-body, we're a madi or a bind or something. We're all one. We're not separated. You know, and so as you run the energy through, the emotions may surge through the person, and they may be crying, there may be deep heaving of crying, there may be very subtle, just tearing, there may be laughter as repressed emotion comes up to the surface. One of the teachers told me recently that he gave a session to a woman who had been repeatedly sexually abused when she was a child. And even though she's been a psychotherapist for over 30 years and has been in psychotherapy for much longer than that, she never felt well. Every day of her life she felt the trauma from that experience. He didn't have to ask her any embarrassing questions or ask her to relive anything. He just put the energy into the part of her body where she felt contracted. And as he did that, the emotions naturally poured up to the surface, and she cried and cried for an hour and a quarter. And then the next session he gave her the next day, more tears came up, but then she was laughing while she was crying too. At the end of the second session, she wrote him this very long, beautiful letter about every form of psychotherapy has totally let her down. She has felt it has not helped her heal what she had going. This is the first thing that has ever worked for her. And it is so gratifying to see that people don't have to try to relive the past and try to fix all that stuff. You can relax. You can be easy with yourself and let the life force energy do the work and just get out of the way and let it come to the surface. You don't have to humiliate yourself and embarrass yourself and try to talk about all those gory or painful details. You can just let the body unwind. And we've seen people go through tremendous catharsis or very subtle catharsis. I've seen as much as half a workshop from time to time have some kind of emotional release, sometimes subtly, sometimes joyfully, sometimes deeply cathartic. But be aware that the emotions do come up during a session, and when they do, be with it. You don't have to fix the other person. It's not your job. Your job is just to be supportive, to love them, to be there for them, to run the energy. Trust the process. It all unwinds. It all comes through quite naturally. And so I guess the only thing left at this point in the workshop is for you to give each other another practice session. And what I'd like to see this time is a 1-hour practice session, and you can be in groups of 3 or 4. And for those people practicing at home, you can be in groups of 3 or 4 as well. And if you have a group of 3, give each other 20-minute sessions, and if you have a group of 4, give each other 15-minute sessions. And take the entire hour and work on the places that need it. Remember, the person receiving the session is the healer. If you want to move their hands, say, no, it's over here now. Oh, it's over here. Oh, now it's up here. Move the hands. And the healer, the person getting worked on, is the responsible party for where the hands should go during the session. You don't, as the practitioner, it's not your job to know these things. Your job is to follow the lead of the person in need of the work. So give each other a full hour and then come back and we'll share what happened during these healing sessions.
Yeah, hi. I was wondering about doing it on myself.
Yes.
And just that, doing it on ourselves.
Yeah. Well, working on yourself is something that you can do. It generally tends to be not as fast, easy, fun, or powerful. If you've had an injury, it can be very effective and very quick working on yourself because the body's not accustomed to that vibration. If you had a chronic condition, running it on yourself can definitely help. My friend Ronnie said it best. She said, running energy on yourself is a little like sex. You can do it on yourself, but it's just not the same. Now, I found, like if I've had an injury, I can do really fast work. I've been able to improve my own eyesight by running energy into my own eyes. The moon was getting blurrier and blurrier, and then it sharpened up. And you can do it, but like when Bob Rasmussen had his gallbladder attack, he just wasn't able to give himself the quality of vibration that he needed to do it on yourself. Now, I have a theory about this, and I don't know if it's true, but I like my theory. My theory is there are many qualities of life force energy. That's why we see some people who have the ability to reshape bunions, and other people who can help heal old scar tissue, and other people who are really good with broken bones, and things that I may not be particularly good at, and I'm not good with dissolving bone calcification. You see some people with bone spurs in the workshop, and the bone spurs can melt away. Everybody has qualities of life force energy, just like we have qualities of love. Now, one person may be very protective, or very nurturing, or very compassionate, or very understanding. There's so many ways that we love. I would imagine, if we understood it better, we'd say there are this wide range of qualities of life force energy. Call them A through Z. Now, I may have the ability to run most of them really well, but I'm lacking in F and M and T and X. Well, gee whiz, the condition that I have really needs those vibrations of energy, and those are the ones that I don't have a lot of access to. You know what? We need each other. And so it really shows up that we need each other. And so when Bob was working on his own gallbladder, he wasn't able to be as effective as I was, even though he had had 30 years of experience, and I only had a short time. Any other questions that are coming up? Yes?
I was just noticing, like, when you're working on the face, that sometimes you were just coming from one side instead of both, and I was wondering how that differed.
When I'm working on the face, I may be working on a particular spot, like the gum, and I'm running energy into the places, but there's actually 2 points being connected, so I'm creating a field between those points. You don't always have to go 100, all the way across the field, although that's very effective too. I could run energy right into the eyes because it's enough of a field that it gets right through there, but I could also work on the eye, front and back, to get there as well.
Do you recommend doing it one way or the other?
Experiment. Play with it. Feel what creates the most sensation. Realize that whatever you do that creates more sensation, it's going to be more effective. And people who work with quantum touch long enough understand that quantum touch is totally sensational. Ta-dum-tum. Okay, what else? Yes?
Probably overly obvious, but on the slope breath, I just wanted to clarify your sweeping, and then, no, it wasn't the slope breath. It was the...
4-4?
No, not the breath. It was the vortex.
Vortex in the energy.
You're sweeping and then you finish sweeping back out, and then you...
No, you vortex it on the way up, you vortex it on the way down.
Oh, okay.
So it's spinning on the way up and it's spinning on the way down.
So you just see it in this...
On the
same
inhalation,
thing,
it's
but
spinning,
spinning.
and on the exhalation down the arms into the hands, it's spinning.
Okay.
It's just... You look at the picture in my book, just shows this nice swirling all the way up and all the way back. By the way, I didn't mention, but my Quantum Touch book is the text for this class. And if there's any questions that you have about what's being taught here, it should be clearly answered in the book, and I recommend people read it because it fills in the blanks that I might have left out.
And the aspect of the vortex when you're doing the Michelin Man, when you're...
Yeah.
Is that part after you've swept that you're going to fill out your field more, or is that as
All
part
through.
of...
All through. It's spinning up, it's spinning down.
Okay, so you're doing it as...
Yeah, it's all
either
one. It's
part.
all one thing as you're
Okay.
breathing in and breathing through. Yes.
As you practice Quantum Touch more, how much of it plays into intuition, and how much of it is communication with your client?
Well, I always like to keep good communication with the person that I'm working on. But the more you practice, the stronger you get. So a lot of people find that the more they practice, the more intuitive they're becoming. And that's fantastic. There's many people who are doing that. I can think of a lot of practitioners who will automatically touch me in the spot that needed it next, and I didn't have to say anything to them, because the process of doing this will open up your intuitive abilities. But for a dense person like me, I like to make sure that I keep a dialogue going with them, and they tell me, and I just go there. So both are true. Both ways work wonderfully well. Well, I guess that takes care of that. Congratulations on completing the second videotape in the Quantum Touch workshop. By this time, you've learned to run energy, do breathing, watch bones move back into alignment, and if you're working with a group, no doubt you've seen some pretty wonderful things happening in that group. I want to encourage you to continue practicing. Do some of the breathing exercises, definitely practice the body awareness exercises. Remember, the more you practice, the stronger you're going to become. Well, that completes the second video, and I look forward to working with you again tomorrow.